Hey, y'all, welcome back, family and friends, to this exciting episode of Black Beat Podcast, where we keep it real, raw, and unapologetically black. Now, please make sure you hit the like and subscribe button on the screen. And before we dive in, I want to give a huge shout out to our sponsors. Oregon Health Authority, coming together for change because when it comes to health, we're all connected. And TriMet. Join the team that keeps Portland moving at trimet.org/career, and Care Oregon, dedicated to making healthcare work for everyone for the last 30 years. Now today, we are tackling a topic that has been plaguing our community for generations, the behavioral health crisis. How did we get here? Why are so many people struggling with mental health challenges and addictions and trauma? And most importantly, what are we doing about it? We're at a breaking point. 5 years ago, the George Floyd moment, COVID cracked open something in America that a lot of folks didn't want to see. That our communities have been carrying the weight of systemic violence, neglect, and trauma for far too long. Major institutions like the newly activated Ballmer Institute for Children's Behavioral Health are joining long-standing efforts by organizations such as the Oregon Health Authority and community-based advocates who have long championed accessible, comprehensive behavioral health care. Each is working to train a new generation of specialists equipped with providing critical support where it's needed most. Now let's just jump into this first. Let me introduce my guest today. First, we have Dr. Kate McLaughlin, a clinical psychologist specializing in children and adolescent mental health and executive director of the Ballmer Institute. She holds a joint PhD in clinical psychology and epidemiology from Yale University. The Ballmer Institute is rolling up its sleeves to provide real cultural responsive mental health support for our communities. And then we have Ebony Clarke, the behavioral health director at the Oregon Health Authority, with more than 25 years of experience as an administrator, manager, and clinician in both the public sector, the nonprofit behavioral health arena. Ebony has influenced policy while centering the work through equity and consumer lens. She's got an inside scoop on what's really happening in our state, where the gaps are, and what's needed to change to turn the crisis around. So let's get into it. No sugarcoating, no fluff. Let's talk about what's real and what's next. Welcome, Kate and Ebony.
Thanks for having us.
We appreciate y'all being here.
Good to be here.
Okay, so let's jump into this. The root of the problem, the behavioral health crisis. Okay, so let's go back, way back, all right? How did we get here? And why is the community, especially the black and brown communities, dealing with so much mental health and issues? What roles have systemic racism, economic oppression, and violence played in the crisis? Now, for Ebony, from the Oregon Health Authority's standpoint of good view, what are you seeing on the ground, and how does Oregon compare to the rest of the nation when it comes to behavioral health and challenges, especially the communities of color?
Well, I will say that Oregon is not unique. Many and most states are actually struggling with the workforce crisis specific to the behavioral health arena. And when I say behavioral health, I always think it's important to define what we mean by behavioral health. And so that really has to do with, the efforts that we take as a system to address an individual or community's mental state, specific to mental health or mental illness, such as anxiety, depression, schizophrenia, and also substance use disorder or abuse challenges. And so when we talk about behavioral health, we're talking about either substance use disorders and or mental health or mental illness. This has been a long-standing issue. We know that historically, outside of just Oregon, across the nation, mental health and behavioral health was and has been underfunded for decades.
Wow.
I want to say that it wasn't until maybe the late 60s, early 70s is when there was a federal effort to really deinstitutionalize mental illness and really work to create opportunities for individuals to get the care that they need within their community and with natural supports. The dilemma was when that initiative was underway, there wasn't funding that followed that. And so quite frankly, we've been behind the eight ball for decades in terms of trying to catch up in terms of resourcing and funding to assure that we have an adequate system to meet all of the needs of all Oregonians.
Wow.
Last thing I'll just say is that we also know that Oregon is one of the whitest states, and we know that Oregon is fraught with history and present challenges specific to institutionalized and structural racism. And what that means is that we then see that playing out in the educational arena, and so then we're not seeing enough clinicians, African-American clinicians, as an example, stepping into the arena to meet kind of the present day Black mental health needs and challenges within our community.
Wow. Kate, you talked about that?
Yeah, well, I mean, aligned with what everything that Ebony just shared, that focuses on what do people do once they have a behavioral health challenge. Can they access the support they need? And the answer, quite frankly, is no, most people can't. But to your question, what drives mental health problems from forming in the first place? What I would highlight is first that we know that most people who are going to struggle with a behavioral health challenge in their life at some point, most of those challenges start in childhood. And the second thing we know is that the root of many of those challenges is adversity and trauma. The majority of mental health problems that start in this country, in Oregon specifically, can be traced to early life disadvantage, poverty, experiences of racism, violence, abuse, maltreatment. And these are really the drivers that lead to the emergence of mental health problems in many children and adolescents. So if we want to address the behavioral health crisis in kids, we have to be thinking about how to address those root causes and how to prevent kids who've experienced societal disadvantage from developing behavioral health concerns that we know are then going to impact their achievement in school, their economic mobility, and so on.
So, Kate, what was the moment, the spark, that made the Ballmer Institute decide that this was the issue, the topic? What made Connie and Mr. Ballmer himself, decide that this is where we want to put our money? What was that spark? What was that moment?
I think that the Ballmer Institute was launched in 2022, so we were in the kind of acute aftermath of COVID and the pandemic. Right. We all, were listening to the national headlines around the youth mental health crisis. What we were seeing is just a dramatic increase in the rates of behavioral health concerns in kids, not just in Oregon, but all over this country. So anxiety, depression, thoughts of suicide, behavior problems, substance abuse were all skyrocketing among kids. Wow. And I want to emphasize, though, this is not just about the pandemic, that we had been seeing these trends going in this direction for years before the pandemic happened. And then the pandemic was just a catalyst for what was already happening. And at the same time, what we're seeing is exactly what Ebony was describing, that families were struggling to find support for their kids. So, we see this increase in mental health problems among kids, and most families, so in Oregon, a majority of families who try to seek support, mental health support for their kids, are unable to find it. And I think that the Ballmers saw those trends, as well as the impact it was having on schools, where we saw teachers now, being asked to, teach classes where there are lots of kids who are struggling with behavioral health concerns. That makes it hard for other kids to learn, for those kids to learn. And they wanted to do something that was really at the intersection of child behavioral health, workforce development, with a real focus on schools and how do we get schools the support they need. The other thing I'll say about it is that, the Ballmers are philanthropists. They give to a lot of issues. And really one of their key priorities is economic mobility. And I think it's important to bring that up because when we talk about behavioral health, we don't often think about about that, but they see, based on a lot of good data, that one of the key ways that we can foster economic mobility for kids is by addressing these behavioral health concerns that often start so early in life.
I would have never thought to connect those two dots. Wow.
And, it's because we know behavioral health concerns impact the way kids perform at school. They impact their long-term economic prospects. And it's a place where we know we've got interventions that work. So if you can intervene early with kids who are starting to struggle, it can be an incredibly powerful driver, not just of their quality of life, but their academic outcomes and their economic mobility.
Today's episode is brought to you by the Oregon Health Authority, coming together for change. Because when it comes to health, we're all connected. So, Ebony, how does the Oregon Health Authority work with an organization like the Ballmer Institute? Where's the integration? Where's the intersection at?
Yeah, well, Oregon Health Authority, specifically within the behavioral health work that we do, we kind of we're the system holder, if you will, and I like to describe it as being the connective tissue between community-based organizations who provide the treatment services, the community mental health program that's ran by counties, that's kind of seen as the safety net, and then the coordinated care organizations, the entity that administers the behavioral health benefit for those who are on the Oregon Health Plan. And so we are the kind of system holder. We help to kind of oversee and govern. It's our job to have a finger on the pulse. And so we, first and foremost, a lot of what we do within the publicly funded arena requires various licensure, certification. There's various state rules or statutes that are required to provide this publicly funded service, first and foremost, to assure quality and safety. And so one of the ways that we then govern or partner with Ballmer is to make sure that we are educating Ballmer about kind of what the current system makeup looks like, what's required from our vantage point and from our key partners' vantage point, what the challenges are, just so that then as Ballmer is working to help fill a critical gap, we can share our learning, our data, our knowledge, and then also provide that technical assistance. And as I said earlier, working to make sure that we're providing that education so that then it all can be within the policy realm, rules and statutes.
Got you. Rules and statutes. So, Kate, so what kind of specialists are you guys creating over there at the Ballmer Institute to come in and plug this hole that y'all got? What's going on over there? Yeah. What are you creating over there? You're creating the next iteration of the specialized counselor? What are you doing over there?
Well, it's a great question, because what we're doing is actually it's a, first of its kind program in the country. And what we are doing is taking the kind of training in behavioral health that you typically have had to go to grad school to get access to, either getting a master's degree or getting a PhD, and providing that training at the bachelor's level. So folks who are getting an undergraduate degree can learn how to deliver services for kids and adolescents to support their behavioral health in the context of an undergraduate program. And this is really novel for a few reasons. So, first, because it has historically required that you go to grad school to get this kind of training, it's created a lot of barriers for folks to get into the behavioral health field who might be interested in it, because grad school is expensive, it takes a lot of time. There are a lot of barriers. And so our hope is that this is not only going to increase the number of professionals who have training in how to provide really critical supports for kids, but can be one way we start to diversify the behavioral health workforce, which I know we're going to talk more about in a minute. The second thing that's kind of novel about this approach is that when you look at existing mental health professionals, most of what they do is really focused on treating problems once they've gotten pretty severe. So for kids, it's getting in the way of their ability to do well in school or get along with their family or peers. This new profession is really focused at kind of an earlier point in what we call the continuum of care, where these are folks who are going to be trained to figure out how you identify kids early who might be struggling before it becomes a 5-alarm fire, where they might need a psychologist or a social worker, and deliver sort of brief, what we call low-intensity interventions that you could deliver in a school or in your pediatrician's pediatrician's office that might help that kid develop some skills that would prevent that problem from worsening over time.
Yeah.
And that's really a different approach than what we see with most mental health professions. And the goal is really to build out this new part of the workforce who can provide care in places where it's really easy for kids and families to access it. So we reduce some of those barriers that make it hard for families to get the support they need.
But, okay, so, and to be honest with you, I'm really excited about that opportunity. Over the years, you're watching how trauma has affected a lot of the culturally specific communities. I'm saying to myself, at what point in time do we really begin to address, the elephant in the room? Okay, and for me today, I think one of the questions that I have to do, the elephant in the living room to me right at this point in time is, how do we get more Black and brown mental health professionals into the field to begin to address some of these things? But I always thought that the shackle on the ankle of the young ethnic or community-specific communities, that, this shackle on their ankle is just trauma.
Yeah.
And that if we can somehow or another begin to address this trauma, that those communities, the young people in these communities, the community themselves can thrive in such a way that we've never seen before. So, but tell me, Ebony, what are your thoughts about what the Ballmer Institute is doing and those individuals that they're training up and putting in our community? How does the Oregon Health Authority look at that?
I mean, we are excited. What I will say is that it takes a village, and it's not one individual, it's not one entity, it's not one provider, it's not one community that can solve the issue at hand. And so it's exciting to see that there is a new breath of energy and innovation and desire and willingness to walk alongside and fill the gap. I think that just in listening to this conversation, I, often say that first and foremost, it's important for us to remember that individuals and communities hold the answer. And as system providers, it is our job to walk along community and not only listen, but integrate the voice and the recommendations that community is bringing forward in terms of what's needed to have that health, wellness, and emotional well-being. And so with that, I appreciate, this innovative model that's really going to be more preventative, that will allow out of the box thinking and, not just your everyday traditional office-based services, because we do have this workforce shortage. It can take a decade to see our workforce return to, that level of stability that we need. And so what that means is that we have to train our new clinicians and providers and those coming up the ranks to be in lockstep with community and support and learn how to use non-traditional methods or the traditional ways that we as people of color heal ourselves. Yeah. And I think that needs to be further integrated into, some of these, traditional clinical models. Yeah. And I know that I'm starting to get too excited and go off.
I'm excited with you. Come on with that one, because that one is an interesting one for me also. Experiential. I think we've lost our way in that area, opening up to more traditional platforms and mechanisms. But Kate, so in light of the DEI issues that we're dealing with and all that, and the fact that we have a shortage of Black and brown therapists and people in the mental health world, is the Ballmer Institute taking on any other perspectives about this, or are they still on track with doing some of the things and fulfillment that they originally suggested that they were going to be doing?
Yeah, well, just building on what Ebony shared, something that we have really prioritized from the beginning is ensuring we're listening to the voices of community as we build really a new professional role. Is this the kind of role that kids and families need? Are we, training our students well in culturally responsive services? And what should that look like? Where should those services be delivered? And so we've got a number of ways that we've been engaging and listening to the community as we build. And John, I know as you're a member of our community advisory board, that's one of the mechanisms that we've used to really take that community input very seriously as we build the program. So a big focus for us has been on how do we prioritize the needs of kids and families who have been historically underserved or inappropriately served in our existing behavioral health system. And part of that is really thinking about new methods for how we bring services into the community. And so as part of the community advisory board, members are doing things like reviewing our syllabi, giving us feedback on, the actual courses that students are having, the applied training experiences they get in the community. And we're taking that feedback and making changes to the program. But one of the things we're most excited about, and this is really just getting off the ground, is starting to partner more deeply with some of the culturally specific organizations that sit on our community advisory board to think about, as Ebony was mentioning, the office-based model of care where you bring your kid to a clinician who sits in an office or maybe deliver services at your school doesn't work for a lot of families. Families might not trust the systems that provide those services for all kinds of good reasons. Now, what we've got in the Portland community is some enormously powerful, culturally specific organizations that have been providing services to this community for decades that families actually trust. So let's think about situating our service delivery with those organizations. Can we embed new providers in these organizations that have typically done things like mentoring programs, youth development, lots of other kinds of community services? Can we build out a behavioral health service delivery arm where families could come to the organizations they trust to receive those services? And could those organizations help our students learn their culturally specific, practices so that our students aren't just learning from folks in a classroom about what it means to be culturally responsive, but are actually getting that experience out in the community from the experts?
And can I just add too, just based on what you shared, based on what you shared, absolutely. So in the 21-23 session, Oregon Health Authority, there was a House Bill 2235 that was passed. House Bill 2235 passed to bring some long-standing funding and resources to address the workforce crisis. And so specifically, there were dollars that were brought forward to incentivize individuals in stepping into the workforce arena, to retain individuals to stay in this line of work, to assist individuals who are already doing this work to go back and get a secondary degree. The funding brought forward opportunities for support for folks to get their certification and licensure fees paid. It was scholarships, tuition reimbursement, loan repayment, things like that. And so I will say that for the most part, most of those dollars have been expended and pushed out to community. Gotcha. We are proud to say that a significant amount of those dollars did go to communities of color. Cool. And what we have learned from it is that it does have impact. We've seen success. We've seen for organizations that did receive dollars for incentives, they had a 94% retention rate. We've seen an increase in our therapists and alcohol and drug counselors, providers, the workforce expand. We've seen the increase in peers expanding. And so with that, we know that it's working. We know that it's critical. And so in this current session, Oregon Health Authority has a policy option package to continue to sustain and further those prior investments, just so that we can continue to be intentional and strategic in expanding the workforce.
Wow, this is exciting, but at the same time, let me play devil's advocate. We got these people out there. It sounds like we got a heck of a lot of investment. Ballmer Institute, $400 million for years, over the last 30 years, the state, the amount of investment that we've had. And we got those people out there that says, well, why should we care about this? I mean, after all, the state was at one point in time, you can come here and do any drug or anything you needed to do, and it was legal. Right? So why there's the citizenry out there that says, well, why should we care? What's the cost of caring at this point in time? Why should we? If we was to appeal to that voice, what would be your response, Kate?
So why should we care about child behavioral health?
Yeah, why should we care? Why shouldn't we just let them go ahead and just do whatever they're going to do? Why should we care about the this
Yeah,
issue?
it's an interesting question, and I would say we've come a long way in terms of the stigma that surrounds behavioral health and mental health challenges. That stigma is still there. A lot of folks might say, you know, buck up, right? Deal with it. You feel sad. Lots of people feel sad, but we actually know that mental health challenges can have enormous impacts on kids' lives in all kinds of ways, not just on how they're feeling in the moment. It can impact their relationships, the way that they perform in school, the way their teachers view them, the likelihood that they graduate high school, go on to higher ed, their economic mobility. And the thing that is so interesting and it's so important about child behavioral health is, those are big issues that are hard for society to tackle, but we actually have interventions that really work if you're targeting the behavioral health concerns, which are often at the root of many of these, problems that can kind of accumulate over the life course. Interventions that don't have to be that costly. They can be relatively brief when you've got a trained provider who can give that child some skills and help them develop some connections to other adults in their life who can be protective. It can have these cascading influences on so many aspects of that child's life if you catch it early. And so as a society, the return on investment that we get from investing early on in behavioral health supports for kids is just enormous. We all talk in Portland, have had a lot of conversations about many of the problems we see on our streets downtown, right? With substance abuse, chronic mental illness, the interventions, which we of course need for individuals, who are having an acute crisis, are needed and are really expensive. When the problem has gotten to that point, all kinds of interventions are needed to really support folks to recovery. But for every person that we see on the streets of Portland, we know that the roots of that problem for almost everyone started in early life. When there are interventions that are not that costly, that we could be investing in to provide the supports that kids need, that could prevent, these problems from accumulating over the course of someone's life.
So when you think about the continuum of care, are you looking at early intervention with this?
That's what we're focused on. We're always going to need psychologists and social workers and community health workers. There's a whole range of professions that already exist. And what we're focused on is really a profession that is kind of bringing this public health approach into child behavioral health of how do we identify problems early and deliver interventions that are low cost, that are brief, that can prevent those problems from worsening over time.
Got you. Ebony, over the last say 15 years, there were a lot of trends that hit Oregon, the state of Oregon, such as Occupy and all of these different types of things. Did you see an influx in these issues during those times? Or in other words, did we inherit a lot of what a lot of the demographic looks like through some of these episodes of different types of things like Occupy and all that? Or is it just, has it been a continuation of growth that is a monitored, predictable growth in the state?
I think it's both. I would say it's been kind of gradual. But what we know is that when there are major natural disasters, we as society see natural spikes in, depression, anxiety, self-medicating, causing folks to increase their substance use. We see spikes in suicide. So I'd say it's a little bit of both. You asked the question of why should folks care? I'll say that we're talking about people. We're talking about community. We're talking about someone's mother, someone's brother, someone's child. We're talking about human life. And with that, every life is important, and we cannot afford for one loss of life. And so that said, if we don't continue to address this, we're going to continue to see issues of suicide. We're going to see issues of overdose. We're going to continue to see increases in incarceration, continued use of the emergency rooms. And that's what we want to prevent. We want to be able to see that return on investment so that we can invest those dollars upstream and be more preventative. And so everyone can be a part of the solution. And as I said earlier, it takes a village.
It's just, listen, I am And this we ain't got enough time to necessarily unpack all of this, but I am so excited about what is being unpacked. And so let's get to what happens next. What are some of the things that you guys are doing as part of the solution in your thoughts? What's the next steps, you guys? What are you thinking is the next steps?
Well, in terms of the work at the Ballmer Institute, we have just launched our training program. We've got our first cohort of undergrads in the program right now. And so what we're thinking about right now is how do we work with the Oregon Health Authority and the state to think about what's the credential these folks are, going to need to practice once they graduate, and working with policymakers and OHA to really figure out what that looks like, so that this new workforce we're training, can go out and deliver the services that they're trained to deliver in the parts of the community that really need it. We want to grow the program. We want to recruit students from all kinds of different lived experiences into the program. We want to help bring greater diversity of lived experience into the behavioral health workforce. So we're working on partnerships with high schools, middle schools, to start getting kids who might not have traditionally thought about behavioral health as a pathway that was available to them as a career option. We're working on really connecting more with the Portland community, with families in the schools where our students are training, community-based organizations, culturally specific organizations, to really refine the program and make sure that the way we're training this new profession is aligned to the needs of the community. And we're collecting a lot of data. So we're housed at a university, and part of our job is making sure that this training program is actually having a positive impact on the community. And so we are talking to every kid who interacts with one of our students, every family who receives services, every school where they're embedded, to make sure that those services are high quality, that they're culturally responsive, that the kids are improving once they've had access to these services, so that we can continue to improve this program and really make it something that is responding to the needs of our communities.
Is case management part of that package?
Absolutely. I think, case management is part of any behavioral health service, right? And, it's a term we use sometimes to tie to particular professions. But the reality is, you can't address a person's mental health problems if they are experiencing housing instability, right? That it has to be a combination of, supporting people's basic needs as well as their behavioral health.
So, Ebony, what's the state prioritizing right now?
Yeah, so we are prioritizing continuing to lean into the Oregon Health Authority's strategic goal of eliminating health inequities and disparities. So we center much of what we do in terms of looking at how are we prioritizing and centering the voice of community and individuals to make sure that we as a system are not furthering or promoting or continuing to be a part of the challenge that creates these ongoing challenges. And so we are not wavering. We are not wavering in our commitment around making sure that all that we do works to disrupt the longstanding issues that you spoke to earlier around the ACEs, around the trauma, around the racism. We, as I said earlier, we brought forward a policy option package where we are requesting an additional set of dollars to continue the prior workforce investments. And I will say that we are working and we will continue to be committed to really partnering with community and not only listening, but working to make sure that all that we do from policy to practice, the voice is acted upon, and that we can demonstrate how we're bringing forward the integration of the recommendations of the community so we can have a more diversified workforce and so that we can have thriving communities.
Y'all, I would be remiss, two sharp women like y'all sitting here with me in the climate in which we're in right now. It just wouldn't be right to let y'all out the room without asking y'all, is there any suggestions? How should we live under the climate in which we're living to prevent any more growth of this specific crisis that we're talking about today around mental health in light of the complications this country is experiencing? Is there any suggestions you have for a better or more effective way of living in this climate that you would have right now for the community at large?
That's a big question.
Yes, but you can narrow it down. If you
Yeah,
want to,
I mean,
know.
and you can answer that question on so many levels, but I think, a lot of what we see is that some of the core values that drive the work of the Ballmer Institute, that drive the work of OHA, feel like they're under assault, where suddenly equity is something that is, a bad word instead of a value that we should embrace and aspire to as a society. And I think that we need to hold tight and hold tight to our values. And, for folks who hold those same values, this is a moment to be vocal, to be active, to think about how can we get out into our communities and make a difference in the lives of kids, and not just feel upset about the way that the world might be changing, but try to do something about it. And, the last thing I'll say is that, working on child behavioral health issues is not for everyone. Not everybody's going to be in the behavioral health workforce, but every single person listening to this podcast has a child in their life. Might not be their own child, but they've got kids that they know. And I would say one thing we can all do is just to pay attention. And when you notice a child in your life starting to struggle, their behavior's changing, their mood is changing, notice that, say something. Provide support. It is remarkable. One of the most powerful tools we have to support kids' mental health is support from adults. And an adult who's willing to listen and not judge when a kid shares that they're struggling with something. An adult who's willing to help that kid find other sources of connection to their community, to their family, to peers, to something that gives them meaning and purpose. And we can all do that in the lives of the kids that we know, even if we're, not out there gonna, change policy or become a mental health professional. So that's what I would say.
Ebony?
And I would just close with saying again that, OHA, we stand firm in our strategic goal of dismantling and eliminating health inequities. And there's power in voice. And there's power in voice for all of us. And civic engagement is important. And I just paused and reflected on your question and thought that we have been in tumultuous and very difficult places in our nation and in our society. But it was the power of people. It was the power of voice. It was a power of commitment that we were able to get to the other side. We have it in us. It takes a village, and we all can have impact.
Whoa. You know something, y'all? I done told you. These two women are something too sharp there, but this conversation is too big to stay in this room, y'all. If you're listening, this ain't just theory. This is real life. This is your family, your neighborhood, your people. So I'm going to leave you with this. What can the everyday folk do? How do you support the work y'all are doing? And how do we make sure that our people are getting the help that they need? You got to tap in. You can't be isolated. It's important that you take these messages and get involved, folks. Stay tuned. And y'all, I'm telling you, we can't just do this one time. But before we exit, is there anything that's burning in your heart that you would like to share before we exit this conversation? Yes.
Yeah. So I just want to say that we must come forward. I do because someone did for me. For those that know my story, my mother was a heroin addict, and I was impacted as an infant and was in foster care for the first year and a half. But my mother got help. I was reunited with my mother, and that's what inspired me to step into this field. And because someone did for me, I must do for others.
Right on. There's so much more. I mean, there were so many layers as I was listening that I would have liked to pass. So surely I'd like to have y'all two ladies back as guests and to continue to unpack this as momentum grows and we're starting to see some results of some of these theories and things that we've implemented. But I do appreciate the one part about the experiential practice coming back in, because ain't no one theory got a lock on this deal. And so I really invite people that have innovation and thought to come into this conversation and be a part of it. So, hey, listen, y'all, this concludes this episode of Black Beat Podcast, where we just keep it real as best we can. And we appreciate y'all, too, for coming on and being a part of this conversation, y'all. and I appreciate you. You hear?
It was an honor. Thank you.
Respect. Today's episode is brought to you by the Oregon Health Authority, coming together for change, because when it comes to health, we're all connected.